Hello, everyone. Thank you for joining us today. We will be starting the webinar in only 5 minutes. So let the students join in and then we can start. Thank you.
So everybody is able to see the screen. Good.
Hi, Dr. Rajat. I guess all the students have joined us. We can start now. Thank you.
Okay, thank you, Asma. So hello everyone. I'm Dr. Rajat. So today's webinar will be a very short and crisp webinar for guiding you to like how to crack AMC in the minimum time duration and with effective study materials. Okay. So if you have any doubts, we'll clear them all in the last. And let's just start the webinar now. In this webinar, I'll tell you a bit about me and my journey till now, and I'll tell you about the tips and tricks for this exam. And the recalls are very important, and I'll tell you why they are important. And at last, I'll be okay. Uh, am I audible to others?
Yes, Dr. Rajat, you are audible.
Okay, okay. And at last, I'll just let you know how we're gonna help you crack this exam effectively. Okay. So I'm Dr. Rajat. I have done my MBBS and MD medicine from India, And after that, I cleared MRCP1 exam, AMC1 exam, and I'm an educator and a medical influencer on Instagram as well. And currently, I have just joined as a PHO in Queensland Health, and I'm registered with EFRA. Okay, so I have I'm just about to start working in Australia, and I'll just tell you how the AMC exam goes. There are 150 questions, and it's a MCQ based question, no negative marking. All this you must be knowing already. Uh, but the pattern of the exam is there will be 150 questions and 30% from the medicine, 20% from the surgery, and rest the subjects like women, child health, mental health, population health. They are 12.5% each. So if we look at the questions, this medicine surgery takes 50% of the questions, and the rest 50 are taken by the other subjects. And if you compare the syllabus of the medicine surgery and the other subjects, there's a huge difference between the medicine surgery takes a lot of time to cover, and the other subjects are like shorter compared to these two subjects. So what I have evaluated till now is, if you focus on the public health, mental health, child health, and women health, you can easily crack it, because medicine and surgery is something you've been already practicing and reading about it all the time in your MBBS. But as my own experience, we are not really good with the psychiatry in the UG times, because the posting in the internship, there is only 15 days posting, and in public health, most of you are from the other countries, and you are not familiar with the public health of Australia. Although it's a very important topic, but the amount of the questions and the syllabus is very less. Okay, so I'll tell you how to read this and get maximum out of the minimum syllabus. We'll discuss about it later. Now let's just start talk about the resources. There are multiple books. Most of you must have heard about John Murtagh and the AMC handbook, and there are multiple books. Okay, so there are multiple books you can read from, but the most important ones are the John Murtagh and the AMC handbook of MCQs, multiple choice questions. Okay, but you during the preparation you can't read these. These are just for your reference. Like if there is a topic and it's being repeated repeatedly in the AMC MCQs, then you can read the topic from the AMC book, but we'll just help you out there. You don't have to read any of these books right now, because we'll provide you with the materials that are important, and you have to read from all these resources. And if you talk about the online resources, there are multiple resources like Medscape, Up to Date, and RACGP guidelines. So what I experienced, I didn't join any coaching, so it was very hard for me to get the right information. So I had to search on RACGP, and I have to check on the Up to Date, and the multiple sites and books I had to study. I did it because I had already done my MD from India, and I was curious. I knew how to read the resources. Like if you open any research paper, you will find it very difficult to go through the complete paper and get the results in nutshell. So it's a bit difficult to find the resources, and I have a solution for that. I'll tell you. Okay, and the tips for your exam: first of all, do not underestimate the exam, because it's not that tough exam, but it's not that easy as well. If you compare it with PLAB, it's tougher on the tougher side, and if you compare it to the USMLE, it's almost like the same level, little bit easier. But if you read the resources, and you have the right resources, because if you go for the recalls, there is a lot of confusion, because the recalls you get are not complete. They are never complete. So if you are trying to do the recalls from the Facebook groups or the WhatsApp groups, and there is no authentic source of your recalls, you get lot of confusion. So in that confusion, you mark your answers wrong. So it's best to clear the concept and then you go for the MCQs and recalls. So if you take this exam lightly, you are never going to pass it. You have to be sincere when you're preparing for AMC-1, just for 3 months maybe, when you are going for a coaching institute and we are providing you with the classes and the notes. You just have to read the notes. You don't have to go for like run for here the books for the guidelines and stuff. We are here to give you that, and if you still have doubts, we'll be happy to help you and answer your queries. And the the answers you'll be giving, because every country has their own guidelines whenever you are treating. Like I'm a doctor in India, and uh, we have different guidelines, and the US has different guidelines, China has different guidelines. So we have to go with the Australian guidelines. That's a must, because in your mind you are answering the right. You are right when you are doing the MCQ, but what they perceive is they perceive from their point of view. So you might be wrong as well. Next is time management. It's a very crucial point whenever you are taking the MC1 exam, because if we think like it's a 3.5 hour exam and there are 150 questions, it's very easy. But let me tell you, most of the students face difficulty while answering the questions, and they are stuck on one question, and at last they are so tense they can't even complete their question their answers. And if you can't complete your exam, you are not qualified for the results. So it's the main problem with this exam. And once you are stuck on a question, you can't move back, you can't move forward unless you answer that question. So you have to answer it. You have to answer it now. Then you can move to the next question, and you can't move back. So it's a major drawback for this exam. But we'll talk about it in our upcoming webinars, like how we can prevent that from happening. So we are not brain frozen. We manage our time better and practice questions, because once you start practicing questions, your concepts become clearer and clearer. And because you have your notes, like let's just imagine I'm taking your classes and you're making notes and you have perfect notes. But you have once you start reading your notes, after one or two readings, you'll be like, okay, I know everything about these notes. But then you move to the questions, and while practicing questions, you're like, okay, I have read about it, but what was the answer? What was the key point in this question? So that clicks here. Okay, you missed something in the notes. Then you open your notes again, and then you find the exact point that was taught and you ignored it during your revisions of the notes. So practicing question is always your priority. See, I have cleared my NEET PG exam in India, and few of you must have known how difficult it is to crack the NEET PG exam, because doctors struggle to pass it like for 5 years, 6 years, and still they can't get their dream job, the dream branch. It's very difficult, but if you have the right strategy, you can easily crack any exam. I cleared MRCP exam without any coaching. I cleared AMC exam without any coaching. But all these exams, I gave these exams after my post graduation, so it was easier for me to crack these exams. But if I compare my MBBS, after my MBBS, when I cleared NEET PG exam, the strategy that helped me, I joined the coaching. They gave me good resources. I just stuck to those notes. I repeated those notes 2 to 3 times, then just went directly for the MCQs. Those MCQs can sometimes, push you down, that, oh, I don't know this, I just read it. But eventually with time, you'll get to know, okay, now I know this topic from by heart, and I can answer the questions. So keep this in mind. So as I already told, focused and targeted approach is the key point in this exam. If you are running from one resource to another, I'll read this, I'll read that also. Okay, that my friend is having some notes from other coaching, I'll read those also. So it's never the right approach. You'll be just standing there with multiple notes and nothing here. You'll be just collecting the notes. So you just collect the quality notes and you read those and go for MCQ and recalls. And trust me, you will be very happy when you answer the questions from your own notes. Okay. And for the bigger subjects like medicine, surgery, even if you are not reading all the topics, you should read the topics that are most important, because the AMC, there is a pattern. They have specific topics, their favorite topics, that the one question will be coming from this topic, one question from coming from this topic. Like I'll just tell you, there is red book, you must have heard. There is in every question, every exam, you're gonna get question from colorectal carcinoma screening, or the question from the breast cancer screening. Yeah, we can't recheck our answers. Okay, so from the cancer screening, colorectal and breast cancer, you will get at least one question or maybe two. So these topics are very important. If you ask me, sir, I have my exam in like 3 days, what should I do? I'll tell you to read specific topics for your last 2 days, and you can easily get 50% of marks. Okay. And for like there are multiple questions with okay, so what will be the next investigation of choice, which will be the best investigation of choice. Okay, so don't confuse between the wordings, because from my experience, what I have seen, there are long stems in the questions. You can't read the question like without wasting time. So what I would do, you just read the task. Can you please mute the mic of the participants? Okay. So what we're talking about? Yeah. So whenever you are reading the stem, and for a moment, if you lose the focus, you have to repeat the question. Yeah, you have to read again. So best approach is to read the last sentence first. Okay, what they want us to answer, like what's their question. Then you start the stem. This will save your time. You'll know what you're looking for in the stem, and you can easily answer the question. So the etiologies, investigations, management, treatment, that's our work, will help you do that. So the concept from the webinar today is, first, revise your notes. Always revise your notes before starting the MCQs. Like make your notes or get your notes, printed notes, whatever will provide you. Second, revise your notes. Third, do the MCQs when you are not revising. Either revise or do the MCQs. Once you are done with your MCQs, you can reread your topics from the MCQ you have done like incorrectly. So if you are not familiar with the topic, you read your notes. If once you read your notes, do your MCQs. So it's like MCQ notes, MCQ notes. By this strategy, you'll never fail. Okay. And the recalls, as I told you, you'll get to know the most important topics that are repeated, not the question, just the topics. Okay, so this topic is repeated, I'll read the topic from the notes. I'll do many questions, as many as possible, from the same topic, because I know they are asking questions from this topic. So once I am done with the topic, we'll be posting the whole webinar on the YouTube, and you can watch the whole webinar again. So the people who are joining us late can just be with us and just get the nutshell. Okay, so recalls will get the important topics. Like these topics have been repeated multiple times in every exam, so we have to go through the notes and the maximum MCQs from that topic. Other topics you have to read, but not like the ones we'll be telling you from the recalls. Second, we'll get to know about the useless topics, because many coaching institutes I have seen, they are teaching you like useless things just to get your attention. Like, oh, they are teaching us extra, so we are better. No, you are not better. If you are getting like useless things to read that you don't need right now at your level for this exam, then it's not a good point. You have to read the important topics. You have to give, okay, you have to repeat the most important topics. You have to go through the lesser important topics, and you have to leave the topics that are not relevant for you, that are not in the AMC book. Okay. And third point is you become confident. Once you are done with the recalls, you are familiar with the topics, you're familiar with the type of questions they're asking from the topic, you will be very confident and you will be able to answer your questions effectively. And and as I told you previously, once you are going through the recalls, you'll get to know about your core concepts, like where you are lagging, and you can just brush up your concepts and you'll be fine. And so at last, I'll be just telling you how med exam experts will be helping you, like how I'll be helping you guys to crack this exam. First of all, you don't have to run for the resources. We'll be providing you with the notes, and we'll be providing you with the notes and the important topics, most important topics, the crisps of red book, and mnemonics for the the topics to be crammed, like the for the colorectal carcinoma, it's a age of your relative who got CRC is less than 55, then screening from which age you have to start the screening in the individual. And the breast cancer 50, I will be providing you with a like authentic source of knowledge, mnemonics, and the crisp notes basically. Secondly, we'll be providing you with the recalls, authentic recalls. Secondly, if there is a doubt in the recalls, we'll be teaching you the concepts. So you won't be having any difficulty once you are going through the exam, because you know the concepts and recalls. So these things will help you. Third, we are here to clear your doubts. Anytime you have any doubts, we have all the experts. Like personally, I have my interest. I have done my MD medicine. I have special interest in psychiatry as well, and the Red Book ethics. The If you go through my Instagram page, it's dr_Gupta_MD. I have taught few clinical topics as well. You can check out those videos, and you'll get to know the faculty of the med exam experts is good at what they are doing. So if you have any doubt, you can check out our videos, and if you have any doubts, we'll be there. Okay. So fourth, we have like our ongoing experience. Like most of our mentors are working in Australia, and they are seeing like what's the protocol there. If we get a question, like when you have not worked in Australia, you don't know what's their approach to a patient, and you just cramming it. So if your mentor is already working in Australia, they can teach you by like what they are seeing, what they are doing. So it's very easy to grab what you guys are gonna mark in your answers. So that's all, I guess. And still, if you guys have any doubts, we are here. You can ask your doubts. I'll answer them very quickly, like in 5 to 10 minutes, and you guys can ask.
Thank you so much, Dr. Rajat, for these amazing insights that you have given to all the students out there. I guess they will be their guide for their AMC preparation journey. So let me quickly share my screen so that I can let you know about our amazing staff of AMC. Dr. Rajat, can you please let me know if my screen is visible?
No, I can't see it.
Okay, let me share it again. Dr. Rajat, you can meanwhile answer the queries of the students. I will check my screen so that I can start after that.
Yep. Okay. See, about the recalls, we can't say like there are groups, but I have experienced if you get the recalls in a month, there are multiple sessions like from the date wise, like one exam is on the first, second, third, fourth, like this. So I have experienced like the questions asked in the initial exams, they are repeated in the next exams as well. But I'll just tell you, the topic remains the same. There is slight difference. So if you are just cramming the recalls from your recent exam, like your friend went through the exam like 2 days before, and they are discussing the topics. If you answer the same, like you answer the same, it it's wrong most of the times because there is some change in the question that you didn't notice. Okay, you want to continue,
Yeah, so
Asma?
this is the basically faculty of our AMC. These are the expert mentors who will be there in your journey, and they will be there to guide you from how to start your preparation. Yeah, can I start now?
Yeah, sure.
Okay, so basically this is the faculty of our AMC. We have Dr. Nabira, Dr. Rajat, Dr. Nilofer, Dr. Farhad, Dr. Sumaya, all these amazing mentors. They will be there for your AMC guidance journey. So let me quickly tell you about what kind of courses we are offering for AMC. So basically we are offering 3 products that will be for your AMC journey. We have regular courses, we have crash courses, we have exam week sessions, all the solution to your AMC problems. If you are a person who is not confident about the basic knowledge, then you can join our regular course. It will be a long course in which we're going to guide you about the theory, about the question solving. Everything will be added in the regular course. But if you are a person whose basic knowledge is good and just want to practice the recall questions, just want to practice the Q bank, the mock exams, then you can join our recall crash course that is for 2 months. That is a quick course. And then if you are done with your preparation, then you can join our exam week sessions in which we share the AMC exam papers every day during the AMC exam week so that you can know about how the AMC is giving you the papers, how you can solve the papers. So now let's quickly discuss about the features that we are offering in the regular course. It is basically, like I told you, it is a long course. There will be live sessions, recording access. You will get the live session recordings on the very next day of the session so that you can watch the recording later as well. You will get the PDF of all the solved recalls so that you can know how the AMC is giving the questions. We will be giving you quizzes, we will be giving you mock exams so that you can assess your preparation, like how well you are prepared. Then we have daily study group discussions in which we have a moderator, Dr. Mavish will be there. She is going to conduct these activities so that all your doubts regarding every topic will be cleared in the study group. And then we are going to give you the notes, flashcards, books, all the important files. Everything will be added in the course. So you don't need anything else apart from our courses. The course is starting from 25th of June. So if you want to get enrolled, you can write in the chat box or a course counselor will contact you for all the details. Now let's discuss about the crash course, which is a 2-month quick plan. There will be live sessions, but in the live sessions, we're going to discuss about all the recall questions. Like we're going to discuss every question in detail with explanation. The mentor is going to let you know how you have to approach towards a question. There will be recorded sessions, mock exams, group discussions, notes, flashcards, everything will be added in this course. Now let's discuss about the exam week sessions. Exam week sessions are basically conducted by our great mentor, Dr. Nilofer Abru, and these sessions are conducted during the exam weeks. And in these sessions, we only discuss about the new exam papers of AMC. Like every day by the evening, we discuss and we share the exam paper questions with you, and we do a discussion properly with correct answers and explanation. These are all done in the live session, and on the very next day we provide the recording, so in case you miss the live session you can watch the recording later as well. And the course is starting from 17th of June, that is basically June AMC exam day as well. So now let's check about the reviews or the students that have joined us and have passed their exam, have cleared their AMC Part 1. You can check the reviews on our pages as well. These are some of the amazing reviews from our My batch. All the students who have joined us cleared their exams. Now, these are the outstanding reviews from our students who have joined our exam week sessions. They have shared their amazing emotions, like how the course went for them, how it helped them. So now I want to announce the bundle offers that you can join for your course next journey. You can join or recall crash course plus exam week sessions and get a discount of $100. These bundle offers are basically designed for all the students who want to join more than one course. So if you join the Recall Crash course plus exam week sessions, then we're going to give you an off of $100 and the whole package will cost you only $400. And one more thing is that because we are here to support our AMC community and we are here to support our AMC students. So if you are unable to, join in the whole fee, we do offer installment options as well. We do offer friends discount as well. So do talk to us. We are here for your support. Talk to us, ask for free guidance. We are here for all the free guidance that you need in your AMC journey. And now the bundle offer. If you want to join the regular course with exam week sessions, then we're going to give you again $100 off, and the course will cost you only $550. That you can pay in 2 installments or 3 installments as well. You can pay in one go or you can pay in installments as well. So do talk to us. Okay, we're going to make customized packages for you as well. Like if you just want to practice QBank, you want to practice only the mock exam, you want to practice only the recalls. So we are going to create packages for you so that it will be affordable for all the students out there. So if you join with us as a group of friends, then you will get amazing discount offers. So that's the amazing thing. So yeah, contact us, talk to us. We will provide you free guidance. We will help you out. We will make customized packages for you so that all the students out there can afford our courses. Thank you so much for this. Was all from my side. Dr. Rajat, are you here?
Yes, yes.
Yeah. Now let's answer the queries of the students. If you have any query, write in the chat box. We will be there for your guidance. Dr. Pratusha, the regular course is basically for $499. But if you contact us right now, we're going to give you a discount on that. We have mentioned our WhatsApp number. Do contact over there and we will give you discount.
Okay, Mobeen has asked Amidux or M plus X. See, I used Amidex, but as I saw our questions from our course, they are from the mixture of Amidex as well as Mplex only, because the syllabus for AMC is not very vast. And if we follow only one, question bank, then it can be a bit difficult for you guys. So what we have done is to collect all the resources and merge them to make the best MCQ, the bunch of MCQs that you need. So you can go with the Amidex, and rest is up to you. Passing percentage for MC. See, the passing percentage is different for like every batch, every month. But I guess it was around 30 to 40%. No, you don't need to buy any question bank because we'll be providing you all the notes as well as the MCQs and the recalls. So you don't have to work, you just have to work to read your notes and ask us the questions you have.
We will be providing you the QBank so you can practice on the website as well. So you don't need any other subscription like I told you before.
See, passing marks, you have to get the 50% passing marks. And I've seen many students failing by like 10 marks or 20 marks. So it's not like they are not reading or they are not brainy enough. It's just the method, the way, the resources they get. Everybody has cleared their undergraduation, so everybody is almost the same. It's just the way you read. Uh, See, the time from what I think, if I was preparing it after MBBS, I think 3 months for your notes and 1 month of your self study of those notes and repeating your MCQs. So some people can clear it in 6 months, some into 3 months only. But beyond like the safer side, 4 months is good enough time to clear it easily. Important to pass each and every domain like medicine separate. No, it's not like that. You have to clear the 50% cutoff and you'll be okay. See, in some questions, although the most of the questions are about the management investigations and stuff, but there are a few questions uh, where they ask about the pathophysiology as well. So you can't just rule out the basic things. You have to read all the stuff. See, it's not easy to get the job after MC1. Your CV has to be very strong to get, because these days there are, see, if you are an IMG, you have selected countries, like some people go for USMLE, some for PLAB, some for AMC. In USMLE, you have to prepare for like 3 to 3.5 years, and there is no guarantee you'll be matched. Second, the for the PLAB, the dates of PLABs are like there's long waiting for PLAB, and even though the job getting job there and NHS, the system in the NHS, it's not really good these days, and I have seen many doctors shifting to Australia after working in NHS because they are not very happy with the pay scale and the working hours. And the third country is Australia. That's the only option these days. And I'll tell you, in the coming years, Australia will be the only country that students will be applying for. So if you want to get a job after AMC1, you should be very good with your CV. And I'll be posting a video about it, like how to get a job after AMC1, as I got my first job after AMC1. Ops Gynae same or different? Sorry, I didn't get your question, iPhone. What's Ops Gynae same or different? It depends upon your luck. Uh, you can get, it's better to get a job in a remote area after MC1. And some people can go for a GP pathway as well. They'll be sponsored for a GP seat under supervision. And there's a different pathway for that. I'll tell you guys later. CV is your resume. See, the MRCOG, even I was thinking like I'll clear MRCP and I'll shift to Australia. But these exams are not valid in Australia. Even if you have MRCG, all the parts have been cleared, it's not possible for you to get a job there, because they want at least AMC1 for you to like join there, or you must have worked in UK for at least 1 year after clearing PLAB route. See, the best time of the preparation is recently, like after passing your MBBS, and it depends how, sorry, and it depends how difficult your house job or internship is. And if you have good time, like at least 3 to 4 hours in a day, you can easily track it during your internship. Lab 2, AMC1 with Lab 2, but no NHS. No, you can't get it. You have to work for 1 year in NHS if you want to migrate to Australia. See, WBA is there, but it's a bit expensive as compared to MC2. And I have recently taken the MC2 exam. It's not that difficult. So I would recommend you to go for AMC2. And there are few tricks to pass it, and I'll just tell you guys in the upcoming webinars. So, but we have a backup plan of WBA as well. AMC registration done any exemptions? See, you have done your MRCOG for UK, but for working in Australia, you have to clear PLAB 1, PLAB 2, and 1 year of NHS experience. If you have done MRCOG and working in UK, then you can't move to Australia unless you are working there as a consultant, like after 8 to 10 years of job in NHS, then you can. See, if you look at the difficulty level, uh, I have taken multiple exams. NEET PG in India, post graduation exam. If we take it as 100, USML is 80, and AMC is 70, and PLAB is like 50. So this is the difficulty level. But for if you think like PLAB is easier as compared to AMC, but you have to work really hard to get a job in UK after clearing PLAB 1, PLAB 2. And ultimately, I don't think you'll be really happy to work in NHS. The rest is up to you which country you choose. My personal, like I'm personally inclined towards Australia. It's really good. The working hours are less, salary is more. After what about nuclear MRCPCH with coded with EFRA appoint me as a registrar still see I am I am joining as a registrar in Queensland Health, and I have done only MC1, so it doesn't matter. Their minimum criteria is to clear AMC1 to get a job along with English test. So if you have other qualifications along with the AMC1, it totally depends upon your resume and your interview, how it goes, and you can easily get a job of registrar. Competent authority pathway. Competent authority pathway is from when you move from UK to Australia. We'll take a different webinar for that. I'll make a video about how to get a job after AMC1. Okay, so okay, so as I have seen, most of the guys are asking about how to get a job after AMC1. See, your resume, your interview, both should be good to get a job. And secondly, you can work there as an intern level job, as in junior doctor level job. You can join as a PHO registrar as well. So it depends totally upon your resume, your interview, and let's just ask the questions related to AMC1 and not just the job, because that's what we were talking about in this webinar. Because this topic is a bigger topic, and we can all plan a webinar on like how to get a job after AMC1, because it will take a lot of time to explain. Like everybody who wants to work in Australia, they need AMC1 along with English test. At least these two must be there. The rest depends the additional qualifications they have, like what kind of job, what is the area they'll be working on, and whether they need AMC2 or not. We'll be conducting a different webinar for that. After you start working there, you can join their different programs and start your residency. Your resume should have all the things like your qualities, your qualifications, your grades, whatever. Like a CV should be good. Once you start preparing, you'll get to know how like recall works, because when you start your preparation, the time will be like you'll take more time to clear the questions. And as soon as you're done with your notes, you'll clear all the recalls of 1 month in like a few hours. So it depends, and we'll be giving you all the recalls from many months. Get the notes you need to read for AMC-1. You can join our classes. I preferred OET. There are no mandatory books. The all the books I have shared in this webinar, they are the reference books. If you have any doubt in your any topic, you can read the topic from those books. Okay, guys, I guess that's our time. Asma, are you there?
Yes, Dr. Rajat,
Yeah.
I'm here.
Yeah.
So all the students out there, if you have any other query regarding how to start, about the books, about the CV, about the job, you have any question related to AMC, just contact our course counselor. We will be there for your guidance. Just give us a message and we will book one-to-one session with you, and then we can explain you about all your queries out there. So that was all for today's webinar. Thank you so much for joining us today. We have shared our numbers over here in the form of WhatsApp links. Just click on that and you will be directed to our course counselors. We will answer all your queries. Okay. So let's end this. Thank you so much, Dr. Rajat, for today's webinar.
Thank you, everyone. We'll be in touch. Even if you don't join our course, stay in touch. You can get our guidance anytime you want. Okay. And we are happy to help you guys. Okay. See you. Bye.
Surely. Bye bye. Take care.